Lab tests aren't the gold standard for diagnosing perimenopause, but they can give us helpful context. I'm Dr. Briana Botsford, the owner of Flow Functional Healthcare. Welcome to week 4 of our 8 weeks of menopause education series. Today, we're talking all about lab testing. One of the first hormones that we often see shift is FSH, or follicle stimulating hormone. This hormone's levels can go between 10 to 12 international units per liter on day 3 of the menstrual cycle, and that might start pointing to declining ovarian reserve. That said, hormone levels in perimenopause can fluctuate a lot, so a single test doesn't always tell us the full story. It's also important to note that if you have an irregular cycle, going for blood work on day 3 of your period may not be feasible. Thyroid disorders can look a lot like perimenopause, so having your thyroid checked is important. A TSH test is essential to rule out hypo or hyperthyroidism. In both issues, hypo or hyper, can cause things like fatigue, mood changes, and cycle irregularities. A pregnancy test is also valuable. Even though fertility is on the decline, pregnancy is still possible in perimenopause. So if there is a sudden change in your cycle or you've skipped a period, it's worth testing. Doing a complete blood count, or a CBC, can be really helpful if somebody has heavy periods or more frequent periods. So we want to check for anemia. A CBC gives us insight into hemoglobin, hematocrit, and ferritin levels, which are all important when bleeding becomes heavier or more frequent. A cholesterol panel, so a lipid profile, is very beneficial because as hormones shift, so does our cardiovascular disease risk. A full lipid panel, which is total cholesterol, LDL, HDL, and triglycerides, helps us keep an eye on long-term heart health and identify any risk factors if they're showing up. Blood glucose and hemoglobin A1C. So blood glucose is a snapshot in time of how well you're managing your blood sugar, whereas hemoglobin A1C is a 3-month measure of how well you manage your blood sugar. And perimenopause can affect insulin sensitivity, so it's worth checking for early signs of diabetes, especially if you have a family history or other risk factors. Vitamin D is valuable because as our hormones shift, that can impact our bone mineral density. So it's worth doing a vitamin D check. It's key for bone health as we head into menopause to make sure that we have adequate vitamin D levels. You can also use vitamin D supplements, but testing is really the only way to know if your levels are adequate and/or if your supplement is working. Liver function tests, so things like AST, ALT, and GGT, are helpful to help us assess how your liver is processing everything from hormones to medications and supplements. It also helps us identify folks who could be at risk for non-alcoholic fatty liver disease or metabolic fatty liver issues. Prolactin is indicated if your cycles are irregular and we've ruled out pregnancy and thyroid issues. Sometimes checking prolactin is useful, especially if there are symptoms like breast discharge or headaches. And then mood and mental health screening can be very valuable as well. So these aren't necessarily blood tests, but women in perimenopause are at a higher risk for depression and anxiety. So mood check-ins or questionnaires can be helpful, even though they're not necessarily a blood test. Not every person in perimenopause needs all of these tests. It really depends on your individual symptoms, medical history, and health goals. And there's also probably things that I haven't mentioned in this list that could be beneficial on an individual level. Other things that I consider when I'm creating a care plan are things like a family history of heart disease, cancer, diabetes, or osteoporosis, acute or long-term stress, sleep issues, and so on. Past diagnoses like PCOS, endometriosis, or adenomyosis may also impact the type of testing that we choose to do. Pregnancy and fertility history, including things like gestational diabetes or preeclampsia, does have an impact on your health outcomes as you go into menopause. And whether you've had routine screenings completed like pap tests and making sure that any mammograms are up to date. At the end of the day, lab tests are just one part of the picture. We also need a thorough health history with symptom tracking and physical assessment in order to put all of the pieces together and guide personalized care. What did you learn from this lesson today? You can email us back and let us know. We'd love to hear from you, and let us know what else you'd love to hear from us over the final 4 weeks of this 8 weeks of menopause education.